Good afternoon and welcome everyone. We're so happy to welcome you to the National Strategy on Caregiving, California at the Forefront. We'll wait just a second here for everyone to join the webinar, and then we will get started. My name is Sarah Steenhausen. I am with the Division of Policy, Research, and Equity at the Department of Aging. And I think what we'll do now, we'll get started with a few of our housekeeping issues. So if you want to move to the next slide, please. Just so you all know, everybody's going to be muted, all of our participants during the presentations. We are going to have a Q&A portion at the end of our panel. So we encourage you to use your raise hand icon during the Q&A or before if you have questions throughout. And then if you also want to speak, when you raise your hand with the hand icon, our moderator of that panel discussion, Chantel Bush, will be able to call on you for that. We do have closed captioning and Spanish interpretation available for this webinar, and you can access that by clicking the icons at the bottom of your screen. Finally, wanted to note to you that the presentation and recording of this will be archived, and you can see the link on the screen for CDA's YouTube channel, which is also available by linking on through our website. So you can always access these and a number of our other programs through our YouTube channel. So I'm really happy to welcome you all here. And at this point, I want to turn it to our director, Susan DeMorris, who will get us started. Thank you.
Thank you very much, Sarah, and welcome to everyone who's joining us today on this webinar, and especially welcome to all of our panelists. I want to thank everybody who is taking the time today, whether you're taking the time to listen or to bring up questions and suggestions or to contribute your expertise. I'm feeling it is November, and I'm feeling especially grateful to our community, our caregiving community in our state. So everyone who's with us today on this webinar. I'm also feeling very grateful to be a Californian, to have the leadership that we have in our state with Governor Newsom, who this month was reelected for 4 more years, and to have our federal partner from the Administration on Community Living for Community Living joining us too, Faye Gordon. Today, I started out my day at 7 a.m. on a Zoom call with my 3 sisters. Today is the 6-year anniversary of when my mom passed. She lived with dementia, and we shared caregiving responsibilities, my sisters and I. And it was a very special way to start this day. And I knew this webinar was coming up, and I can just want to share that my experience is personal too, and I'm deeply committed as director of the Department of Aging, working in partnership with other departments, other agencies, and of course, our governor's office to improve the life for family caregivers in our state. So it is now my pleasure to turn the program over to Kim McCoy-Wade, who serves as Senior Advisor to Governor Newsom on Aging, Disability, and Alzheimer's. Kim, welcome, and thank you for being here with us today.
Thank you so much, Susan. It is an honor to follow you. I was thinking about where I will be in 1 week, which is around a table with multiple generations. Literally about this time is when we sit down to share the Thanksgiving meal. And some of these topics that we're going to talk about today are absolutely on the menu for next week. So this is very timely. I have the terrific honor and privilege of just passing along the greetings from the governor and the first partner. So I will quickly do that, and then I can't wait to hear the rest of the terrific program. So the governor on the first day of November did issue a letter to celebrate that this is Family Caregivers Month and Alzheimer's Disease Awareness Month. And he called out how important it is to recognize and honor Californians caring for their parents, their spouses, their adult children, and other loved ones. We have more than 4 million family caregivers who each play a vital role in our families, in our communities, and our economy. And the governor notes that women provide the majority of unpaid care that makes it possible for older and disabled family members to live in the homes and communities of our choice. So with that, we want to hand it over to the first partner who has a video that if you didn't see it on Instagram earlier in the week, we're going to share it with you here and just, again, echoing our warm welcome and best wishes for a wonderful webinar, wonderful holiday, and Family Caregivers Month. Thank you.
Every November, we honor and celebrate caregivers across the country and in our own lives, because care work is the backbone of our society and fundamental to our humanity. And it is through care work that our economies and institutions can thrive. Yet care work is often rendered invisible, leading to caregivers being undervalued and underpaid. Caregivers deserve our respect, recognition, and support. In fact, the invisible care work that women mostly shoulder inspired me to create my latest documentary, Fair Play, which explores gender inequities around care work in the home and our society at large. So to all the amazing caregivers out there, thank you for everything you do. The physical, cognitive, and emotional labor that you expend for the benefit of others is beyond inspiring. And let's not forget, it's our humanity. So please take care of yourselves. You are essential to our community's well-being. We appreciate you more than you could ever know. Namaste.
Thank you, Kim, for sharing that and for joining us to kick this webinar off. You are our partner in all things good, so thank you, and best wishes for you, Kim, for your Thanksgiving holiday next week. It is now my pleasure to introduce to you a woman I had the privilege of meeting about 2 weeks ago. Assemblymember Nazarian hosted an event in his district at Jewish Family Services of Los Angeles. He did that in partnership with Alzheimer's Los Angeles and brought the community together. And I really enjoyed talking with Elena Tillman and hearing her own experience as a family caregiver. And she was gracious enough to agree to join us today and to help lead us off by providing us some insights into her experience. So Elena, welcome to you.
Thank you, and thank you for inviting me. I want to say, I didn't even think about it until you all started, that our caregiving journey started with the holidays. Years ago, my parents came to visit, and we never imagined how our lives would change. My dad had a stroke before they could return home, and it was evident they had to remain here. And that started us on a 12-year-long journey of caregiving. He had 3 more strokes before he passed away. And when he did pass, my mother was 93 years old at the time, had dementia. And we realized she could not go home alone, so she lived with us. 2 years later, her sister, who also had needs, came and joined us. And so we cared for those 2 at the same time. And they have both since passed. But we were blessed in the fact that here in California, we have the Caregiver Resource Centers. And without that center, I don't know what we or others would have done, because they're a godsend. And as caregiving families, we need a lot of emotional support. We need a lot of education and even financial support or resources to direct us. And there needs to be, though, more outreach, not just here, but in all the states. There has got to be more outreach to the Black and Brown communities, immigrant communities, and rural communities, because they tend to keep their loved ones at home, but are the last to seek resources. A lot of times because they're not aware that they're there, or just that the way they've been brought up, you just don't ask. You do it at home, and that's what you do. That's where your family members reside. And so I'm hoping that what I have to say and the others on this call will bring the hopes that there will be more funds made to begin partnering now with faith-based organizations and community-based organizations, especially since we have Cal AIM here, because these places are going to play a major role in connecting families to all of the resources that they need. And I just, I'm so glad that I am here in California, because in talking to people around the country, they don't have what we even have at all. And oftentimes they're wondering, can they join us in some way? So thank you again for letting me tell my story.
Thank you, Elena. And thanks for being here. And I know this isn't the last we've heard from you. You're a wonderful advocate, and we appreciate all the work that you do locally in your community to raise these issues with important elected officials in city, county, and state and federal government. So thank you so much.
Thank you.
Speaking of important officials, I'm pleased now to introduce all of you to Faye Gordon. Faye is the Regional Administrator for Region 9 for the Administration for Community Living. Faye represents the Biden administration and the U.S. Health and Human Services Agency here on the West Coast. She's based in San Francisco, and she represents us on the national stage, and she's going to now share with all of us. We're so excited to hear about the National Strategy for Family Caregiving. Faye, welcome.
Great, thank you so much. And I just wanted to say thank you, Elena, for sharing your story and for the decades of caregiving for your parents and your aunts, and the pieces that you brought up about the need for outreach and support and connecting with faith-based organizations. Those themes have been echoed many, many times, and I think are reflected in this strategy. So I'm excited to share about the strategy, but also want to hear more feedback. And so really looking forward to the discussion from the panelists. So thank you for raising those issues, Elena. And yes, thank you so much to the California Department of Aging for having me today. This is my favorite topic, so I'm really, really happy to be here. I'm going to start my presentation, so if we can go to the title slide, thank you. When I mentioned to Greg Link, who is the director of the Office of Supportive Services and Caregiver Programs at ACL, that I'd be speaking, he was so excited. He said, California has been leading, one of the first states to develop a caregiving strategy. He was thrilled that CDA was focusing on this webinar. So I just wanted to share the enthusiasm from ACL that California is prioritizing this and continuing the discussion and strategy building on supporting family caregivers. As Susan said, I'm the regional administrator for ACL in Region 9, and Region 9 includes California, Arizona, Nevada, Hawaii, Guam, Santa Mai, and American Samoa. And I've been in this position for about 2 years, and my role is really to hear from these states what is happening and what services are needed and what improvements are needed and what ACL can do to support the aging network and the disability network, and then to share information from the Federal Administration for Community Living to the states. So that's what I'm hoping to do, is serve that liaison role today. Prior to this role, I worked in the aging network with Justice and Aging, and just really, really happy to see California's continued focus on supporting caregivers. So I want to talk about the National Family Caregiving Strategy. And on the next slide, if there's anything that anyone takes away from this presentation today, I hope it is that ACL understands that supporting family caregivers is going to require a coordinated, all hands on deck approach. And the release of the National Family Caregiver Strategy is really a step in that coordination and coming together for support. We know that caregiving impacts everyone across the lifespan. I'm just going to pause for a moment. I'm not seeing the interpreter, and I just want to make sure. Okay, great. All right, thank you. That's great. Okay. So we know that caregiving impacts everyone across the lifespan. It impacts children who are being raised by grandchildren. It impacts adults caring for their own parents who are getting older, or parents who are caring for their adult children with disabilities. So this is an issue impacting, as someone said earlier, 4 million Californians, 53 million people across the country, a wide range of diverse needs and backgrounds. And really coordinating supports and services is key to creating that foundation of support. So on the next slide, a little bit of background as to why we at the federal level are talking about this and able to focus on this. And really it's because of a law. So in 2018, Congress passed and the law, the RACE Act became the law. And that was the result of years of advocacy of caregivers and the disability community and the aging community really pushing, saying we need some sort of federal guide and strategy and answer to supporting caregivers. And in the past few years, there's been an incredible effort from caregivers and stakeholder organizations to develop that guide. So there were 3 components in the law. The first is the Family Caregiving Advisory Council, and we may have participants from that council on this call today. It's a wonderful representation of leaders in caregiving. They developed a report to Congress, and now today we have the strategy that came out of these years of effort. So on the next slide, I want to emphasize that with this all hands on deck coordinated approach, I really want to emphasize how critical partnerships have been throughout this effort. The John A. Hartford Foundation has been leading and really trying to support ACL's efforts to support caregivers. They collaborated with ACL to develop the concept for the RAISE Resource and Dissemination Center at the National Academy for State and Health Policy. The National Academy for State Health Policy partnered with 3 amazing organizations, the National Alliance for Caregiving, UMass Boston, and Community Catalyst. And so I just hope to emphasize that the Dissemination Center is led by organizations that are working closely with caregivers. And this has really been a government, stakeholder, foundation, local leader, state effort to produce the different components of this strategy. On the next slide. In addition to all these critical partnerships, I also want to emphasize how important public engagement is throughout this process. This strategy is really the result of truly thousands of contributions over the past 3 years, from responses to the initial request for information in 2019, to many different focus groups, to listening sessions and the advisory council meetings and guidance from stakeholder organizations. We know that with something as significant as caregiving that impacts so many lives, that it's critical to gain perspective from a variety of entities who support and work with caregivers. So that includes employers, providers, faith-based organizations, and we really hope that the strategy here reflects the contributions of that very broad base. So on the next slide, here we are, it's 2022. And in September of this year, the Administration for Community Living released the national strategy to support family caregivers. The Secretary of Health and Human Services, Javier Becerra from California, actually released this strategy. It was very exciting. But I want to really emphasize the significance of this. As you see on this slide, it says, until now, there's been no national approach to recognize and support family caregivers. So it's 2022, there's 53 million people who identify as a family caregiver, and it has taken years and years of effort and advocacy and building community and outreach and education to get to this point. And I work in the federal government now, but as I mentioned earlier, I've been on the other side before as a stakeholder, and I know what it's like to see so many documents come out from different agencies and RFIs and comment periods and reports. And it can really be easy to see a document like this strategy and think of it as just one of another flurry of information. So I'm just really wanting to pause and communicate how significant it is that as the result of thousands of people working and pushing, that there is now these shared goals, these 5 shared goals, and one singular vision for holistic support to support family caregivers. I know there's probably people on this webinar who've pushed throughout the years and worked with different caregiving organizations to make this happen, and want to really emphasize just gratitude and how significant it is to have this strategy in place. So a few key components on the next slide before I go into details on the strategy. Throughout the strategy, throughout this work, there's been 5 priority areas for action. And this is really the priority areas that the RAISE and Grandparent Advisory Council emphasized. They said, whatever happens, you need to be sure that there's an emphasis on awareness and outreach, that there's engagement of family caregivers as partners in healthcare and long-term services and supports, that the services and support exist to support family caregivers, that we really emphasize the financial and workplace security so that employers are brought on and employers understand the significance of caregiving. And then whatever happens should really be grounded in research and data and evidence-informed practices. And I know we're going to hear more about research from Dr. Young in just a few minutes, though I will wrap up because I'm eager to hear about that as well. So these were some of the really guiding priority areas for the strategy. In the next document, a few of the components in the strategy. It's a little bit tricky because there's a lot of different moving pieces here. But the first component up at the top is the main narrative, and it really sets the background and rationale for all of the recommendations. The piece I want to emphasize here is actually at the bottom, which is the 150 actions that states and communities and others can take. So if you go to this document, you will see actions, not just, general recommendations or philosophies or ideas, but really what can we be doing at a state level to provide that direct support for family caregivers. I also want to emphasize just above it, what's very significant is there's 350 actions. Sorry, I get so excited. I speak too quickly. I'll stop. There's 350 actions that federal agencies can take in the near term to implement this strategy. So we're really putting emphasis on what states can do, communities can do, but also showing here are the different agencies at the federal level that impact family caregivers. What are their specific actions that they can take to implement the strategy? And those are detailed throughout the document. I won't open up the document or go into it. I'm happy to put a link to it in the chat box later, but I will on the next slide. I just wanted to show one just example. So I was looking through the piece on the 150 actions for states and communities. And what struck me throughout was how forward-thinking and innovative California has been in their caregiving. And I really want to emphasize how critical the master plan on aging is for California, because as you look at these actions, if you go to the report, there's so much that's already in goal 4 in the master plan on aging. So goal 4 is the one on caregiving that works for family and friends. And if you look through that, a lot of it is very parallel to what these direct actions are. So for example, it says state agencies can develop and implement plans to support family caregivers. And so California is already so forward thinking on that. And I just really want to emphasize all of the efforts that CDA has done over years to really set the groundwork for other states to model in their caregiving work. On the next slide, I want to emphasize 4 of the themes and considerations that the advisory councils really pushed throughout this strategy, because I think it's really important to note that this is the guidance and direction that the federal agencies have. So they made it very clear that whatever happens, the person and the family must be at the center of all interactions. So whatever decisions are made and strategies can force, it has to be centered on that individual and what is occurring to them. So truly person-centered from the beginning. In addition, all of these strategies must address trauma and their impact on families. And I know for many of us who've been working in the Aging and Disability Network for a while, we've known the importance of trauma-informed interactions and work with our clients, but we haven't not necessarily seen that emphasis in guidance sort of at these national levels. So it's really important to see here how much the recognition of trauma impacts families. Similarly, every action and every decision that's made must advance racial equity and support for family caregivers in underserved community. This is a huge component of HHS's equity mission, and it parallels exactly what's in here and prioritized within the national strategy. And then finally, there's a recognition about how all of these decisions for family caregivers impact the direct care workforce. So again, this is very focused on family caregivers, but a clear understanding of the need to strengthen and improve the very critical direct care workforce. So moving on to the next slide, I'm just about to wrap up, but there's really a call to action within this strategy. We know that family caregiving is complex. It's anxiety producing and empowering. It's meaningful and exhausting. It's lonely and hopeful. And there's a lot there. And we know that on an individual level. So the strategy is really looking at how do we elevate the conversation on caregiving? How do we reframe the narrative? How do we drive change and innovation, be a tool for advocacy, and shape research? So it's trying to think long-term about what family caregivers need. I will put in the chat box in a moment when I wrap up my presentation, a link to comment on the strategy and a link to the strategy. The comment period closes in 13 days. So I encourage everyone to review it. And for anyone who is here who helped shape the strategy and worked on those advisory councils or worked to implement the RAISE Act, I just want to emphasize my gratitude. And I hope that this can be a really helpful tool for the states and for caregivers. On the last slide, I have my contact information. I'll look at some of the questions in the chat box, but please feel free to reach out to me individually. I'm trying to get to know as many different organizations in California as possible, and want to be a resource and just really want to be available to you. So thank you, Susan and Kim and Sarah, for prioritizing family caregiving and inviting ACL to be a part of this discussion today.
Oh, we so appreciate you joining us, Faye. Thank you very much. And thank you. ACL has done a fantastic job of making this material available to us, but to have you walk us through it as a state really helps, for us to focus on it here this afternoon and to hear from some of the leaders in our state who will follow on the panel. So we really appreciate you taking the time to do that. And we do, if your one goal was to convey that caregivers are recognized and understood, I felt that way. So thank you. Thank you very much. And thanks for sharing your contact too. I'm sure others will follow up with you and invite you to events throughout California. I now have the pleasure of introducing Dr. Heather Young. Heather Young is affiliated with the Betty Irene Moore School of Nursing at UC Davis with the Caregiver Resource Centers. She'll be presenting data that she did as an evaluator for the Caregiver Resource Centers and Family Caregiver Alliance. And she is a key member of the Master Plan for Aging Stakeholder Advisory Committee and continues to work closely on the implementation of California's Master Plan for Aging. It's wonderful to have you here today, Dr. Young. And let's hear about the data evaluation.
Thank you so much, Susan. I'm so honored to be here and to join this esteemed panel of speakers. I want to thank Kim, Susan, and Sarah for your leadership. It's such an exciting time to be in California and to see the changes that we're all advancing together. And Faye, thanks for sharing your exciting news about the national strategy. I look forward to reflecting on our progress in the particular area of the CRCs, the California Resource Centers, Caregiver Resource Centers, in relation to that strategy. And Elena, thank you for introducing the California Caregiver Resource Centers. You are a recipient of their care and support, and I'm going to give you an update today, hot off the press, of our annual evaluation of the California Caregiver Resource Centers, the relevant findings related to this conversation. Next slide, please. I'm part of this, the group, next slide, please. I'm part of an evaluation team at UC Davis in the Family Caregiving Institute that is co-led with Dr. Janice Bell. And we're really honored to be partners with all the California Caregiver Resource Centers in conducting this evaluation. Next slide, please. And I want to give you a little bit of background about the California Caregiver Resource Centers. They were first established in 1994, and it was the first in the nation statewide network of caregiver resource centers. They're community-based nonprofit agencies that cover the entire state. And like many things, they come and go in the sense of funding that's available. And in 2009, they were defunded significantly during the recession. But recently in 2018, the funding looked better. And we were so pleased that there was a $10 million a year augmentation in the years 2019 to 2022. And now it's a permanent augmentation to expand the services and supports and for evaluation as well. Next slide, please. An important backbone of the scaling and expanding services was coming into the digital world. And the Family Caregiving Alliance, Caregiver Alliance, led by Kathy Kelly, has worked for many years thinking about how to make caregiver resources more available across the lifespan, across the diversity of all of our caregivers in the state, and to also think about how technology could help. And so they designed CareNav, which is an online platform that provides a uniform assessment, enabling us for the first time to collect statewide data on the caregivers who are served by the California Caregiver Resource Centers. It also is very much client-facing. It provides a dashboard for clients that shows them about the assessment information that they provide and provides tailored resources to them for education, for referrals, for service authorization. It also enables secure communications that are HIPAA compliant, and also enables the sites themselves to track and report the services that they're delivering. And we can actually use this data now to guide our strategy and to guide our program development. Next slide, please. I want to share a little bit about what's in this assessment, because one of the national recommendations in the strategy is about having standardized assessment that's evidence-based. And CareNav provides this. It has many domains, including information about direct care, what's going on for the caregiver and the person who's receiving care. It also includes information about planning for care and the kinds of resources necessary to support. And then importantly, caregiver health and their symptoms, their physical and mental health, and how they're doing in the experience. Next slide, please. Our work is guided by this model that was developed within the Home Alone work, and Kathy Kelly and I were both co-investigators on this study with AARP colleagues. And we really are interested in looking at who are the caregivers, what are their needs, what are they doing, how do they feel about what the care that they're providing, what resources do they have to provide complex care, and how does this affect their quality of life and their health and well-being. So this model guides our thinking and our analysis. Next slide, please. We use multiple sources of information from the CareNav database, a tremendous amount of quantitative data. We also collect reports that the sites develop on what they're doing and their outreach. We compare the data to national and state data sets, and then we talk to people, which I think is really important. We have focus groups with clients, with staff, with leaders, and we interview and get really detailed information from everyone. Next slide, please. This is a picture of California and the areas that the different CRCs serve. And you can see some are serving a vast geography. And this is a summary for last year, just a snapshot of what they've been up to. They completed over 6,000 intake screenings and over 4,000 new in-depth assessments of caregivers. They served almost 15,000 caregivers with clinical services, and about a third of these were new this year. They provided over 130,000 family consultations. They counseled in one-on-one counseling 441 caregivers. Over 2,000 received respite, 165 received legal and financial assistance, and they engaged in 9,000, almost 10,000 outreach activities and over 1,000 educational activities. I'm very excited to say that there's a statewide education platform now, and out of those, about a third were delivered in languages other than English. Next slide, please. I want to give you a little bit of a feel for who are the caregivers of California. And this slide is a little busy, but I'll summarize for you that caregiving is happening across the lifespan, across gender identity, and across racial ethnic groups. The predominant number, most people who are served by the CRCs are in the age range of 45 to 84. And the blue bars are the caregivers, the yellow bars are the people receiving care. And you can see on this graph that actually the people receiving care tend to be older, majority being over 65. By gender, we're about 3/4 woman, female, identified as female in this population. And the race ethnicity is quite diverse. It somewhat reflects the California population. It's underrepresenting Latino caregivers a little bit. It's 38% in California and 29% in this database, and overrepresenting white caregivers, 53 versus 35 in the California population. But we're serving Asian American, Pacific Islanders, Black African American communities, as well as American Indian and Alaska Native communities. So a tremendous amount of information across age span and as well as across racial ethnic groups. Next slide, please. Of the caregivers we serve, about 1/4 work full-time and 12% work part-time, but almost 20% are below the federal poverty level. The majority of people in the caregiver group are children, adult children of people that they're supporting, and about 1/3 are spouses or partners. Next slide, please. There are 2 important points about the caregivers served by the CRCs in California. One is that their caregivers are dealing with complexity of care. The other is time intensity, and I'll share some more about that on the next slide. But as far as complexity goes, people are dealing with incredibly demanding health conditions. By far, the most common care recipient primary diagnosis among the caregivers is Alzheimer's disease and related dementias, followed by stroke. But 40% of all these caregivers are helping people who have more than 4 chronic conditions. So even the people who are living with dementia are also living with other very complex chronic conditions as well. I think it was really important to note that almost over 90% have some memory loss, and almost half can never be left alone. So these are people who are requiring a lot of intense care and support. When we asked about medical nursing tasks, we find that almost all are dealing with medications, but almost half are dealing with medical equipment, meters and monitors, or managing pain. So the people who are served by the CRCs are definitely complex and needing a tremendous amount of support. Next slide, please. I also want to make the point that caregivers are engaged in long-term and intense care. They're providing many, many hours as a primary caregiver, and often they're doing this as the sole person providing care. Almost 3/4 are providing more than a full-time job, 40 hours a week, and over half have been doing this for more than 2 years. So it's a long-term commitment with a tremendous amount of time. We compared this, we looked at an ARP level of care indicator that includes both how many hours a week people are providing care, along with the supports for activities of daily living. And out of the caregivers served by the CRCs, over 90% are at the highest intensity of supporting the people in their family or their friendship network. The next slide, please. What we're finding too is that this is having an impact on caregiver health, that the caregivers who are served by the CRCs, about 1/3 report being in fair or poor health themselves. About 1/3 are experiencing health declines, that their health is actually worse than it was 6 months ago. And about 20% of the population of caregivers have symptoms of depression and loneliness. And almost 2/3 are experiencing strain. So this is a group of people who are paying the price of being caregivers as they're supporting people who are complex. Importantly, only about 1/3 are satisfied with the support they get from family and friends. And as we saw in an earlier slide, most of them are going it alone. They don't have that kind of support. And almost half are satisfied with their spiritual support. Next slide, please. One of the questions we've asked as a team is, how does this compare to the rest of the world? Because there are other surveys out there on caregivers and how caregivers are doing. And so we compared the California information from the CRCs to both the state database, which is the California Health Interview Survey, and a national survey of caregivers called Caregiving in the US. And both of these are population-based surveys. And so they're typically people get phoned and they're asked these questions. And what sort of brings up the issue of who answers the phone and who is too busy to answer the phone. Because as you see the information I'll share in the next couple of slides, you'll find that the caregivers that the CRCs are serving are a much higher intensity and needing greater support than we get to hear about in the population-based surveys. The differences demographically are not too large, except that in California with the CRC population tend to be a little bit more female, more racially and ethnically diverse, and working a little bit less. And that's partly because they're providing more hours of care. The next slide, please. As you can see here, that 72%, almost 3/4 of the people in the CRC sample are providing more than 40 hours a week, where in the state database, only 9% are providing that level of care, and in the national database, about 1/3. We're also seeing that more people in this population of the CRCs are either spouses or partners or children of the person receiving care, whereas in the national and the state surveys, they tend to be other relatives. Very importantly, and this is something that's dear to the hearts of many of the people in the panelists today, is that the care recipient diagnosis, the percent of people who are living with dementia, Alzheimer's disease or related dementia, is over 68% in California CRC population, compared to just over 5% in the state and national databases. And I raise this because when you think about policy and you look at the data that's necessary to make good policy, you have to ask where to look for the information so that you're not missing important information in terms of shaping that policy. I think the most stunning finding in this comparison, though, is the level of high intensity. And over 90% of our caregivers in the CRC system are providing high intensity care. And in the national group, it's at 41%. Next slide, please. And as you might expect, this has had effects on caregiver health in ways that are really profound. The CRC caregivers have a higher rate of expressing less well health, and also that their health is worsening over time, and are distinctly more lonely than the state level, state database. We also, next slide, please. We also asked about satisfaction with services, because as Elena said, the CRCs provide a lifeline for caregivers. And we find that it's very highly valued by caregivers. The caregivers who are engaged are very satisfied and would recommend the care. Those who express less satisfaction are those who are not covered for certain benefits, who might be excluded because of income eligibility or other types of issues. And those wish that they could have more as well. The benefits that the caregivers identify for us is through the services, they feel more confident, they're better able to manage care, they're more knowledgeable, and they're able to take better care of themselves. Next slide, please. Diversity, equity, and inclusion is a really important emphasis in California, and the CRCs are deeply committed. They shared with us a number of different areas that they're focusing on as they address these important issues of equity, working on providing culturally and linguistically congruent supports. And this is through bilingual staff, sharing staff, and translating materials, using the data to actually guide outreach priorities. And as I mentioned earlier, sharing a statewide calendar of educational events that allows more sharing of diverse languages as well. Building community partnerships. Several people have mentioned faith community partnerships. That's one, and there are many other kinds of community partnerships. And then tailored messages and services. And this is an ongoing journey. So I want to sum up how I see California being at the forefront, and then also what we could do to continue to improve. Next slide, please. So California really is serving people who are providing complex, intense, and time-consuming care. These people are all often the primary caregiver with little additional support, and they are paying the price with their own mental and physical health. California has a client base in the CRCs that is multicultural and diverse and across the lifespan. And we're also able to see how the CRCs tailor their supports and services to the kind of geography and the communities they serve. And that's a real strength, that in the regions we can actually reflect what's needed. And people are very satisfied. I'm so excited about it, and not just because I'm a data nerd, but having CareNav is an incredible asset to the state of California. It's a powerful database that we can use not only to understand who we're serving and what we could do better, but to actually explore some of the really important questions about family caregivers over time and how we can design approaches that would have the highest impact. Next slide, please. So in terms of the alignment with the national strategy, I think we're very much on the path already, and we can amplify, we can accelerate what we're doing. We already have a standardized assessment with a single point of entry. That the standardized assessment includes several validated instruments that will help us to really look at the evidence base in the work that we're doing. The online platform facilitates tremendous access, and we're actually actively evaluating this data and working very closely together to understand the impact of the information. I want to close with the opportunities that I think are important to advance further. And that's the next slide. Thank you. To achieve equity and inclusion in our diverse California population, we do need regional and state level strategies and additional investments. We have to close the digital divide for all caregivers. And so some of this is access, it's having broadband access, but it's also having the necessary training and supports to be able to access technology. We can work on our standardized assessment, which is now offered only in English, to move it into a more trauma-informed and culturally appropriate assessment in multiple languages. And this is really important work. I think we can expand services further. Right now, as you saw, we're serving in the hundreds of thousands of caregivers. There are 5 million estimated caregivers in California, so we've got a long way to go to reach all of them. I think we could do better in using the CareNav data to develop those strategies that we could use to expand and improve our outreach, particularly tailoring it to serve underserved populations. And the system of the CRCs, the fact that they're working together as a system and as a group is a very powerful asset. And I think we can go much further in optimizing accesses and resources across the state. And then the part that I'm really excited about is sharing the lessons learned and hearing from you. So I'll close by saying thank you so much for all of you who are out there who are caregivers. Thank you for the care that you provide. And thank you to all of our colleagues and allies in this important work.
Thank you so much, Dr. Young. And, you know, I couldn't agree more with you that CareNav is a real asset to the state of California. And I want to commend the Caregiver Resource Network for the foresight when we were in good budget times to put things in place. So we now have this data. Mm-hmm. Our secretary, Secretary Galley, who heads up the Health and Human Services Agency, you know, our guiding principles are person-centered, data-driven, and equity-focused. And what you just laid out in front of us, you know, today is person-centered, data-driven, and equity-focused. So we look forward to learning more from this data, to using this data to advocate for the caregiver resource centers and for family caregivers around our state. So thank you so much for sharing with us today. It's been just a pleasure to have the Caregiver Resource Centers now part of the California Department of Aging. We're learning so much from our partners at the CRCs. Collectively as a system, as you said, it's so impressive how the 11 regional centers work together as a system and network, and also how there are unique and individual differences by region that are really tailored to the population. So thank you for that overview. It's now, before I turn it over to Chantel Bush, who's the chief of our Health at Home branch, I wanted to acknowledge a number of California Department of Aging staff leaders who are with us on the call today. And I especially want to extend my appreciation and gratitude to the governor, the legislature, and our Secretary of Health and Human Services, Dr. Galley, for the resources that we have at the Department of Aging now to truly focus on caregiving, to have subject matter expertise in-house, and to have leadership in our department and with the master plan for aging for the year to come and for many, many years to come. So before I turn it over to Chantel Bush, I want to acknowledge Dr. Nakia Theory, who is with us today, Tanya Bautista, Teresa Booth, and Valerie Rodriguez. These are our hardworking, the team behind all things caregiving, whether it's the Caregiver Resource Centers or the Older Californians and Older Americans Act funding for caregivers, or the one-time federal dollars that we've been fortunate to receive in our state, the ARPA dollars and the HCBS spending plan dollars. So Dr. Theory, Tanya, Teresa, and Valerie, and of course, Chantel, who will be moderating for us now. Thank you all for your exceptional work at the Department of Aging on behalf of family caregivers. And I'll now turn it over to Chantel Bush.
Thank you, Director DeMorris. Good afternoon, everyone. I just want to thank you for joining us. So after hearing from Faye Gordon on the National Family Strategy on Caregiving and consideration for state and local partners, such a heartwarming and personal story from Elena Tillman that many of us can relate to or will at some point in our lives, and also the sharing of the findings and data shared by Dr. Heather Young. This just segues so appropriately into this grand opportunity for us to engage with key leaders to reflect on the information presented today from our speakers, and to hear more about what opportunities California has to lead in serving our caregiving workforce. So now we're going to go ahead and kick off our panel discussion. Please allow me this opportunity to introduce our panelists today. We have with us today Dr. Donna Benton. She's the Executive Director of USC Family Caregiver Support Center. We also have with us Joe Colbury, the Executive Director of Passages Adult Resource Center. Barbara McLendon, with Public Policy Director of Alzheimer's Greater Los Angeles, and Alexandra Castillo-Weisgerber. She's the Director of Care and Support of Alzheimer's Association of Northern California and Northern Nevada. Thank you all for joining us this afternoon. So I'm going to go through a list of questions just based upon the information that was shared and presented with us today. And my first question is for you, Joe. As Executive Director of Passages Adult Center in Chico, you provide core services through the Area Agency on Aging, including the Family Caregiver Support Program. From your experience, what do you see as the most critical caregiving opportunities and needs emerging at the local level, particularly for those living in rural areas in the regions you serve? Joe, I think you're still muted.
How's that? Can you hear me?
Much better. Yes.
Great, thank you. I appreciate the appreciate that. I wanted to just thank Faye Gordon when she showed her slide deck and made the comment about family and person centered. And you know, we're at a time, rightly so, where we're definitely looking at programs to be person centered. But with caregiving, the family member is so important, and so having that recognition of a family member central to a caregiver is so critical for all of us to recognize, you know, particularly when people are in a situation where maybe someone has dementia or in advanced phases of Alzheimer's, the family member is critical to that service. So I, again, just appreciate that, the term and the use of the word family and person centered. Looking at caregiving, particularly in the rural areas, the areas that we have challenges with is access to a variety of services. Some of the urban areas, we can definitely get our caregiver services, but in the more rural areas, we really lack an infrastructure. One of the greatest areas of need is medical providers. We might have doctors and PAs and clinics, but if you're looking to get to a specialist, a caregiver could be traveling with a family member, in some cases, you know, 3 to 5 hours to get to a specialist, or having to travel out of state. So just access to the services is the first major challenge that we run into. In addition, transportation, again, if you have to travel out of the area, you have to have a vehicle or have to have a driver. But even within the community, I would say that transportation is limited at best. And if you're looking for medical transportation, we're very challenged. In a more populated area in a community, you may be able to get a dial-a-ride. But if you live 20 or 30 miles from the closest population area, there are very few services that are able to meet your demands and your needs. Workforce has been a real challenge for us. prior to the pandemic, and the pandemic only opened it up for us where we saw even greater challenges with workforce. But even right now, we can provide respite services to anyone in our service area, but some communities, we have a hard time even finding workers to provide that service. And I'd give you an example of Plumas County. They have about a 40% of the population is over the age of 60. And so that's an example of a community where it's already an older community and it doesn't have the workforce population to provide the paid caregiving work. Now, isolation has been a problem before the pandemic. The pandemic really got it to the forefront, and we're grateful for that. And now there's a lot of recognition of the challenges that people face. But for the rural and those frontier areas, isolation is even greater. You could be an hour away from the closest population center. So being in contact with anyone is a real challenge. We do an emphasis on support groups, and during the pandemic, we did a fair amount via Zoom. But what we found was in some of the rural areas, they don't have internet access, or if they do have internet access, it's slow. As an example, a dial-up, and a Zoom meeting takes way too much broadband, and so it wasn't really a great answer for us. It's kind of like a double-edged sword. We love the fact that we have technology to reach people in distant areas, but those distance areas are not always prepared or have the infrastructure to respond to that technology. So that's been one of our challenges. We are slowly getting back into doing our in-person groups, and they are very successful. We had to kind of roll the dice and take the chance with COVID as the pandemic was beginning to wane. But we realized if we weren't able to do those support groups, as an example, in person, they weren't going to have any contact at all. So those are just some of the challenges. Some of the areas that we've delved into to try and support caregivers and get a little bit more creative. We will directly send books to people so they can have the information on hand. We'll provide assisted devices to them. We do have contracts in place and folks that can actually go out and we can widen their doorways. We can put in grab bars. We can put in lift ramps to help that caregiver care for the person at home. So we have those things in place. We definitely like to refer to any of the local resources that are available. And then again, lastly, I'll just close with our greatest challenge, though, I think, is access to medical providers and particularly the specialist.
Right. Thank you for that, Joe. All right. My next question is for you, Dr. Benton. As Executive Director of the USC Family Caregiver Support Center, you have seen how important these services are for family and friend caregivers. What strikes you most about the findings outlined in Heather's presentation, particularly as it pertains to the growing diversity of our caregiver population? And what do you see as the most important issues to be addressed at the state and local levels?
Oh, thank you so much. You know, when you look at what came out of the data from CareNav, one of the things is that demographic portrait really brings up a factor that's key to understanding why we need to kind of change the narrative around care and caregiving. What we saw is that there's racial and gender and health inequities that are significantly impacting the family caregiver experience and in turn, the people that they're caring for. So for example, if you think about African-American caregivers, they generally have had a lifetime exposure to cumulative experiences of racism that probably results in some of that differences that you're seeing in complex care needs. They haven't had the same level of education, employment, healthcare, housing. And, you know, we call that like social determinants of health, but we could add to the normal social determinants of health is the caregiver experience. And so we can extend our understanding of health disparities to include the impact on how caregivers are able to care in our state. And, you know, so this overall could reduce the quality of care that can be provided by ethnic caregivers And so it means that we need to bring more support to specific ethnic groups. And that was borne out by the data. The other thing is that, the populations around that complex care, that longevity, it doesn't have the same impact, even though many ethnic groups are living longer. You'll see that for these populations, they're at a higher risk of spending their older years in declining health, not as much income, virtually no savings, and maybe more likely to have things like a dementia. So the caregiver in these populations, again, are dealing with people who are sicker, but the caregiver themselves may have fewer resources, both financially and emotionally, and for their caregiving responsibilities. So what I think is very important for us as a state is that we have to continue to realize that one size is never going to fit all. And I think that is one of the strengths of what we saw from the Caregiver Resource Center system, is that they are looking at and trying to develop programs that are evidence-based and based in an understanding of what the caregivers in each of these different diverse communities need, both in racial communities and cultural communities. And as a state, we have to make investments that allow for the time to develop trust in those by the community members, and allow them time to reach out and find services. The other thing, I just, when I think about caregiving and what can we do in a local way and for our different populations, is that we have to build up that sense of respect for caregivers and what caregivers do on a daily basis. And it has to be beyond lip service. We have to continue to make investments for caregivers. And we also need to change the how people see caregiving. I think it would be wonderful if we started earlier in educating people at different levels, from kindergarten all the way up, to normalize the caregiving experience and have it so that when kids grow up, they say, I really want to grow up and, I want to be a firefighter, I want to be a doctor, and I want to be a caregiver. And that's where I'd like to see us move to.
Thank you, Dr. Benton, for that perspective. My next question is for Alexandra. Alexandra, as Director of Care and Support for the Alzheimer's Association of Northern California and Northern Nevada, you see firsthand how caregivers of individuals with Alzheimer's and related disorders are impacted. Where do you see California emerging as a leader in serving caregivers of individuals with Alzheimer's, particularly in relation to addressing social isolation, which we saw emerge on a large scale through COVID?
Yeah, thanks, Chantel, for the question. So as we have heard, California is home to nearly 5 million unpaid family caregivers, and 1.1 million of those caregivers are caring for an individual living with Alzheimer's or another form of dementia. And we know that being a caregiver can feel isolating enough. And when you compound that with being in a pandemic where many of the services have not been available for a while, it's been extremely difficult for many of our family caregivers. As we know, most of the adult day centers in California were closed for a portion of time. Caregivers didn't feel comfortable allowing in-home care workers to come into their home for fear of getting COVID. And if a caregiver's loved one was residing in an assisted living community, they were often unable to visit them, again, contributing to that further isolation. In addition, many of the caregivers we work with who live in multi-generational households were experiencing double that impact. And so especially our sandwich generation caregivers who are caring for an aging parent, working and simultaneously trying to homeschool their children. And I often saw this in my work, working with the Latino community, where caregivers or cuidadores were experiencing so much burnout and isolation. And so as leaders in this space and witnessing the impact on our caregivers, the Alzheimer's Association, the state of California, and various service organizations developed programs to really foster those connections and reduce loneliness to help mitigate both the short and potential long-term consequences for health and well-being. And so some of those specific actions included using technology to really foster those virtual connections, such as online support groups, as we heard earlier from Joe, those live but virtual education classes for caregivers regarding maybe how to manage difficult behaviors during COVID, or how to communicate with their loved ones effectively. And some of the adult day centers even were providing some of those virtual social engagement classes. And so that said, many organizations and the state recognized early on that there was this digital divide for our seniors, in particular, those from diverse and rural communities. So resources such as the Broadband for All and iPad distribution programs were created in an effort to really reduce that digital divide amongst seniors. At the Alzheimer's Association, we really have seen firsthand how well people living with dementia and their caregivers responded to the virtual programming. And for the most vulnerable, it's still the safest way for them to connect with others. And in addition to those online platforms, the Alzheimer's Association provides a 24/7 helpline where caregivers can call at any time of the day to get information, support, resources, and connection to additional services, such as the state-created Neighbor to Neighbor program, which encourages Californians to connect using the Nextdoor website or application. And volunteers can really use the site to safely check in on and connect with neighbors, and really that focus and emphasis on older adults and caregivers. And then from a diversity, equity, and inclusion perspective, diverse programs and services have been adapted to facilitate the ease of program delivery by offering in-language programs virtually and through Facebook Live. And now we're going back into person. And we really continue to collaborate with various partners. We've heard that on this call today, how important it is for that community partnership and to collaborate with others. And so we are collaborating with the Mexican Consulate and Tzu Chi Foundation to jointly offer programs addressing those caregiver needs and social isolation. And because we recognize that many of individuals face limited support and internet access, further contributing to that isolation, we've enlisted the support of our media partners to expand media campaigns to ensure that our helpline has additional visibility in diverse communities. So if caregivers don't have access to a computer, they can at least pick up that phone and get that support any time of day. We've also developed what's called the Cafecito Network, which brings service providers in California who work with the Latino community together to really identify those best practices in service delivery and to learn from others. How do we just best support our family caregivers who are experiencing this isolation? We know that addressing social isolation and loneliness is just one aspect of the broader effort to address mental and behavioral health for our caregivers and for people living with dementia. And from a policy perspective, I would say that the state's investment in workforce training through the Department of Aging and Healthcare and Access Information really places California as a leader in this space. And in addition, with the new changes to the Medi-Cal asset limit, more individuals living with a dementia diagnosis may be able to qualify for adult day health centers without having to pay out of pocket, which research has shown helps them stay in community longer, minimizes the total cost of long-term care, and provides respite for those caregivers and interaction for the care recipient, so really reducing isolation for both. And finally, as we are now returning back to in-person delivery of programs, the Alzheimer's Association, along with various community partners, are hosting community needs assessment forums to learn from the community about where they see the gaps in caregiver services and how we as organizations can help fill those gaps as it relates to program development to reduce isolation and improve the overall mental health and well-being of our caregivers in all communities. In fact, on December 3rd, in partnership with the Del Oro Caregiver Resource Center and the Capital City Black Nurses Association, the Alzheimer's Association will be hosting an African-American Alzheimer's Community Assessment Forum in Sacramento, where we will hear from the community about caregiver needs, and we would love for people to join us. So I will put that flyer in the chat, along with the Alzheimer's Association 24/7 helpline. So thank you. Thanks for having us today.
Thank you, Alexandra. Some great information that you shared, some really good nuggets of some upcoming opportunities for the community to be getting engaged. So thank you for that. My next question is for you, Barbara. So Barbara, as the Public Policy Director for Alzheimer's Greater Los Angeles, you provide critical insight and analysis into the policy opportunities for individuals with Alzheimer's as well as their caregivers. What is your sense of how California might leverage the national caregiving strategy to advance system changes for this population?
Thanks, Chantal. It's great to be with you all today. I just want to start out by acknowledging that systems change is really hard. It takes a lot of time, tenacity. You really have to be in it for the long haul. And I think that California really is well positioned to leverage this plan because just the meeting that we're having here today and talking about this demonstrates the commitment of state government to this, as well as we've been a partner with the state for it's almost a decade now on working on systems change in the healthcare space. And so I've seen commitment over time, but I also understand that it does take time. So we really do all have to recommit ourselves today to continuing to work to make those systems function better for our families. So I know that I'm focusing on people who are caring for a loved one with Alzheimer's or another form of dementia, but I've always believed that if you build systems that really truly serve our families well, you will have systems that serve all of us well. So whoever you're caring for, what we want are systems that are going to do a better job of recognizing your needs. I'll focus on change within the healthcare system, but I do have to say that our families interact with all different kinds of systems. So one of the things I love about the national plan is that it isn't just focused on healthcare. It talks about, needs in the workplace and financial issues. And so I do think that each of us who are on this call today, there's something in that plan for us to do as individuals within our own organizations. If we are legislative staff, if we work in a government agency, there's something in there that we can all do to advance and make California a better place for our caregivers. So I do hope that we all do that if we haven't already done that today. So at Alzheimer's Los Angeles, we have really focused a lot on what can we do to improve our healthcare delivery systems. A lot of work has been done to make these our systems more person-centered. We are, as Joe mentioned earlier, we are using now person and family-centered language more. But I'm here to tell you that it's still really too often the case that family caregivers are an afterthought. Now they get seen by the system because the system knows they're critical to providing the care for the person who's been brought in, who's got medical needs. But is anybody turning to that caregiver and asking them, what do you need? Do you want to be able to provide this kind of care? Do you know how to do it? And I would say 9 times out of 10, the answer to that question is going to be no. So the national strategy, I think, aligns beautifully with what we know are best practices for dementia care. So what would a dementia-capable healthcare system look like? Well, it would be one where when that caregiver goes in with their loved one who has a kind of cognitive impairment, the medical staff are also talking to that caregiver, taking note of who they are, documenting that information in the medical records so that as that person moves across all of these different healthcare spaces, there's some common knowledge about who is the support for this person. And then sort of the dream that I have is that we don't just do a really good job of assessing the person with cognitive impairments. We get an accurate diagnosis. We assess that caregiver. What do you need? Because just because your loved one got a diagnosis of Alzheimer's and dementia does not mean that you have the expertise to do the kind of really intense caregiving, some pretty significant nursing care that you might be providing. And unfortunately, we still don't have any kind of intervention that's going to truly slow the progression of this disease. So their needs are going to be changing as the disease progresses. And so are we checking in with them to say, what do you need now? Unfortunately, all too often that isn't happening. So what we would also like to see is a healthcare system that engages these caregivers meaningfully when they're developing the care plan. Because again, if you have a beautiful care plan and you never turned and asked the caregiver if they were capable, able, willing to be a partner in carrying out that plan, your odds of success have just declined greatly. And then finally, and again, I think the national plan does a great job of raising this issue up, is this ongoing need for training and support. So I do think that there is a lot that we have done here in California. The CalAIM within the Department of Healthcare Service has been committed to pulling forward best practices and working with organizations like Alzheimer's Los Angeles to embed early some of these best practices so we can build a program that is going to be more dementia capable. And then of course, the state just launched Dementia Care Aware, which is again built on best practices about how can we more accurately diagnose and how can we do a better job with supporting these caregivers. So I do see California as, I think it was mentioned earlier today that we're a leader maybe in some ways even ahead of the national plan that was developed, but that plan really provides a larger framework for the work that we're doing. It helps, it's another way to amplify the needs here and get people engaged. And then I really need to come back to something that Donna said earlier, and this is, and Alexandra referenced it as well, but issues of health equity. So it is just a fact that communities that are at higher risk of developing an Alzheimer's or dementia are also those communities who are experiencing barriers to care. And so if we are going to make real systems change work for everybody in a state that's as diverse as California is, we need to be very honest about what those barriers are. We need to understand that in different communities, there are different ideas about what dementia is. There are different ideas about who is a caregiver. If you're not identifying yourself as a caregiver, are you likely to reach out for official caregiver services? Is information being provided in ways that are culturally appropriate, that are linguistically accessible? Are we dealing with the fact that there are a lot of families don't have the money to be able to bring in-home care, which is, I must say, where most people with an Alzheimer's or dementia live. They are not all living in nursing homes. The vast majority, over 85%, are with us in the community. They need help in the community, and that help is very expensive. So how are we helping people in every community across the state be able to bring into their homes the kind of care that they need so that they can stay in their homes, which is where most people want to live? And again, as Donna mentioned, communities where there's been broken trust, frankly, between the community and the healthcare system. And we need to acknowledge that and repair that so that we can more effectively meet the needs of people who are living within those communities. So although a lot of work needs to be done, we are, I think, in many ways on the right path. And so we need to use this plan to just further energize our efforts, maybe give us some new ideas about systems that we can reach out to that maybe we haven't thought of before, that we can improve. But I do believe that we can take more steps today to bring forth a state that better supports our caregivers. We ask so much of them. It honestly seems like the least that we can do to try to build systems that better meet their needs.
Great. Thank you, Barbara, for that. I'm just hearing just a common theme with everybody's responses today that just really lends itself back to what Faye Gordon had presented to us earlier with commitment, the community collaboration, which is just a braid of action, equity, and ideas. So I think we just have some good nuggets of information that we have been provided today, some resources that are going to be shared out, and then the commitment of our participants today, just listening in on the call. So there is a really good starting point for all of us to continue this work. That being the case, I'm going to go ahead and now open it up for Q&A. We do have some questions that have been presented in the chat. So I'm going to read some of these off, and please, panelists, feel free, if anything resonates with you, you feel like it's appropriate for you to answer, please feel free to chime in and go ahead and answer these questions. And then I want to encourage all of the other the participants today that if you do have a question and you did not put it in the chat, we will also be allowing you to raise your hand and we will call on you and we will unmute your line. All right, so one of the questions that came up in the chat here is regarding the CRC systems, which are of care for focus of 100% on the family caregiver needs. And just wanted to make sure that people know where they can find these resources in their own communities. Is there a particular place that you all want to direct folks to in your particular areas, or a common place where we can direct our participants to go to find out more about caregiver resources in their communities?
Yeah, I mean, since everybody here happens to be online, they can go and just go to caregivercalifornia.org. And when you go to that particular website, you can find the resource center in your area by clicking on a map. If you're more map minded, you can put in your zip code, and that will give you the direct caregiver resource center that covers your area. So that's caregivercalifornia.org, or just Google California Caregiver Resource Centers. And so that's For those who aren't, who want to make a phone call, you can also call most of the caregiver resource centers. So I would offer that you could call our center at 1-800-540-4442, 1-800. So that's toll free everywhere. And we'll direct you to the right caregiver resource center. So you can make a phone call or you can go on the web.
Thank you for that, Dr. Benton. Do we have anybody with any raised hands who wants to unmute their line, or just all the questions in the chat for now? Looks like they're all in the chat at this point in time. Okay, here's just a common question. I'll go ahead and read this out. I work for Vision y Compromiso, organization that works for the Latino communities. My program is targeted to support caregivers, family members to ensure the dignity, a human good health. Our efforts are focusing in the family caregiver to support them in the process to get access to resources, programs, and create a good communication with the medical network. So this more or less was just a comment, just sharing that there are some resources in their particular areas that are really designed to address the Latino community. So that's great to hear. See if there's anything in particular. Is the CareNav data available to communities and others? That might be a question for Heather.
Thank you for that question. And it really prompts an idea. We just recently transitioned to the California Department on Aging. And I think one of our agenda items to talk with them about is how to display the information, because we very much want to make it available to all of you to be able to use and think about and to be able to incorporate into your planning. So thanks for that suggestion implied in your question.
Thank you, Heather. Here's a question. What are some of the most critically important issues that negatively impact quality of life for caregivers? What are some solutions, and what would that process towards change look like?
I'm happy to answer part of that question, Chantel. And I think what we know is caregivers' health, right? They spend a lot of time taking care of their loved one, making sure they get to the doctors, they get their medicine, they get all of these tests done, but caregivers, and it's easy to say, you know, take care of yourself, but how do we incorporate that? How do we really, as providers, allow them that space? And maybe that's identifying respite care so that they can go to the doctors or even go to the grocery store by themselves or take a walk with a friend. But I think in an ideal world, as well as when our loved ones are going in for their checkup, are we able to have the doctors or the nurses encourage the caregivers to get their checkup at the same time? Because so often our caregivers are focused on who they're caring for. And so being able to really help them as providers understand and schedule those appointments for them if needed.
Great. Thank you, Alexandra.
I would add financial health. I think that's something that we often don't talk enough about. And the fact that caregivers will step out of their employment roles to be able to provide care. And then not only does that affect their income in the present, but it affects their future earnings and ability to be able to be safe in their older age as well. And I think that some of the solutions around that are looking at how to support caregivers financially, whether it's through federal or state policies, looking at family leave and paid leave. When you look at intersectionality of people who are already of low income and they're caregiving, and you add gender and you add race and ethnicity to that, you end up with people who are incredibly high risk for economic sacrifices. And it's a real barrier. And so that's something that the private sector employers have to think about, and also the public sector.
Great, thank you for that input, Heather. Okay, let's see if there are some other questions. It looks like there's a lot of resources that have been shared also in the chat that we will be able to provide as well. Let's see if there's any additional questions here that have not been answered. Let's see here. It looks like a lot of them are more just commentary. Sarah, did you want to chime in anywhere?
Yes, I do actually. I just wanted to make people aware of a really important opportunity right now that's really time sensitive. And it has to do with supporting our direct care workers and our our unpaid family and friend caregivers. So if you're aware, California Department of Aging recently launched It's California Grows program, which is a training and incentives program for direct care workers and for unpaid family caregivers. So I'm going to put the link up in the chat for people to look at. It's a wonderful opportunity to develop training and resources for our valued family caregivers. So I encourage you all to consider applying.
And I
That's
know
it for me.
thank you, Sarah. And I know we're coming up on the hour here. So what I wanted to do is just conclude our panel discussion. Thank you all for the questions that have been submitted. I want to thank again our panelists, Joe Coburry, Dr. Donna Benton, Alexandra Castillo-Weiss-Gerber, and Barbara McClendon. Thank you so much. And I'll turn it back over to you, Director DeMorris.
Thank you, Chantel. And to our panel, I mean, I love this view right now. I just feel like we could throw anything at the faces that are on my screen and we could answer any caregiving challenge that faces any of us. So thank you so much for sharing your expertise with all of us today. And for others that are adding into the chat, we really wanted to make this a resource for people that are calling in. We do know, and we heard it from Elena at the outset, that often the holidays, whether thanks, November, December, when people are seeing loved ones for the first time, and we know now, for many people, they're seeing them for the first time after 2 or 3 years potentially. That a lot of family members discover that somebody they love needs more care and support than they had imagined by phone or FaceTime. So heading into the holiday season, for those who are caregivers or who support caregivers, we wanted to make resources available to all of you. And we will commit to making our website at the California Department of Aging to uplift all of your resources. We're about to do another postcard mailing. The Department of Aging has done this a few times to several million households to encourage vaccinations and boosters. We're about to do that again. And we make all of these numbers available on the postcard that we do as a direct mailer. So thank you again, everybody, for your time, for what you do every day. I know this takes you away from your day jobs, which are very important to all of us. So thank you so much for being part of this, and to the CDA staff, thanks for organizing and leading this webinar. And we wish everybody a wonderful week. I hope everybody gets a break next week and a little bit of respite over the holidays. Thank you. That concludes our program.
Thank you.